ophthalmology and focusing on the practice in general. And we'll be sharing some tips to remember when you're shopping for an electronic medical record system. Uh, the first question that comes up is, why should you invest in an EMR? Uh, it is far, far more efficient than physical records. Uh, in one go, you can view the entire history of a patient, the vulnerability of physical records, the inefficiency of physical records, having the patient carry their physical records with them every time, your whole cost and burden of storing those physical records can all be taken away. Not to mention all the other advantages that can come up with a whole practice management system that you can implement. For example, these are the records that a patient would present with. He would have these bundles of cards which would have all the past history, dating back years. And if this is your first interaction with the patient, it'll take you at least 10 to 15 minutes to just go through all the cards, organize them chronologically, and to actually make sense of what has been done to the patient so far. On the other hand, you could have one screen which already shows you everything, including the procedures that have been done in the past, every visit that the patient has come up, every diagnosis that the patient has had so far, every physician who's seen the patient so far, all investigations done, every prescription given. This would take you maybe 40 seconds at most to glance through everything and understand that, okay, this is what has been done for the patient, this is why he's here, let's move on. There's been a lot of research that has been done on EMRs. The American Medical Association in 2016 did a study where they tried to understand the physician's point of view and understand what the physicians want from an EMR. And what the results showed was that they basically want that a physician wants an EMR should improve the quality of care that I provide to my patients. It should enable me to work with other doctors better to reduce redundancy for the patient. An EMR must be modular and configurable. Whatever you have today, it must expand and be able to do more tomorrow. It should reduce your cognitive workload. It should be able to pick up dangers. You should have drug allergies in there so that you know that this is not to be prescribed to the patient. It should facilitate digital and mobile patient engagement. Our patients nowadays are using more and more electronic devices. They are going online more and more. If you have a patient portal where the patient can access their records, a patient portal where you can engage with the patient by reminding them about their next appointment, reminding them about their medicines, it'll make it a much better experience for them. Then it also is very important, as has been mentioned with all the previous machines, that an EMR also, whoever is providing it to you, they must provide service. They must help you go through the niggling issues that you have in implementation, in support, and always continue to help you grow it better. There are organizations such as Health7 International which have helped define clearly what an EMR should do. And it is really worth going over these documents that they have produced to help understand what all an EMR can do, what all an EMR should do. Before you sit down and go over the different EMRs that are available in the market, it is important to understand that what is really expected from them. Even the Ministry of Health and Family Welfare has, in 2013, issued guidelines for the standards for EMRs in India, and it's been updated in 2016 with a particular emphasis on privacy of data, because there have been a few issues in the past where companies have sold this data without the physician's knowledge, and there is more and more interest coming up on how to secure and prevent this data from being leaked, from being sold unauthorized. And it is, again, important to go over all of these documents and just help understand what exactly we are looking for. You have to sit down and go over what all do I need from an EMR. Am I looking at just patient records? Do I want billing solutions for my patients? Do I want financial reporting for my organization? Am I looking at a patient portal to engage with the patients? Am I looking for electronic prescriptions to dispense? Am I looking to integrate it with my existing infrastructure, my machines, so that their reports can come online? Whatever you need, it must be stable. If you have an unstable EMR that is crashing all the time, all of this is pointless. What hardware do I have? What hardware will I need to purchase? What about the data security? Am I looking at a server-based system which is in-house, or do I want a cloud-based system where I pay a monthly subscription fee and I get whatever I need? What am I looking at mobile capabilities? Am I looking at a system which can be only accessed on a computer or even a tablet, a phone, anywhere? So you need to start with a needs assessment of your own organization. Are you looking at just health records? Are you looking at a whole practice management applications? How many users are you going to have? How much equipment do you need to have? How many computers do you need to purchase? What is your existing network like? And again, are you interested in investing in a server with inbuilt storage solutions for you, or are you looking on hosting this on a cloud? What devices are the people inside your organization going to use? Again, what systems or data does the EMR need to connect with? And there are also very good open source options available. Do you want one of those, or do you want a system with all the bells and whistles? And most important is not to just understand what you need now, but rather what you will need 5 years from now. You need to look at scalability. When we look at the challenges with adoption of EHRs in India, one big problem is cost. And cost can be divided into upfront costs, which will be a one-time license fee for any software that you're purchasing. It could be the hardware that is going to be bundled with it, or the hardware that needs to be purchased separately to implement it. There will be recurring costs. Again, you've gone over this since the morning. AMC, maintenance. Even an EMR will require constant maintenance and upgradation. You will maybe need to hire some IT staff to maintain your hardware, maintain your network. If you are looking at cloud-based services, then you're looking at a subscription fee. And it is important to understand that these subscription fees will actually continue to rise in cost as you're hosting more and more data on their servers, and as your patient clientele increases. There can be hidden costs which an EMR provider will not tell you upfront. That if you want any customization of the product for your own institution, it'll cost extra. Then if you have an integrating system which you want that the EMR should interact with that. If you have already an attendance-based system, if you already are doing some kind of appointment system for your patients, and you want your EMR to integrate with that, it'll all cost you extra. And it is very important to sit down and have an upfront discussion with the EMR provider about all these things. The most crucial thing is that, yes, you can get a demo for an EMR where they can come install it on your system and you can try and use it for a few days. But it is crucial to actually talk to someone who is using that EMR. Get a real world user experience. That how stable is the system? How user friendly is it? Is their staff able to actually extract what they want from it? How quick is it? Has it slowed down everything for them, or has it helped them be more efficient? There are excellent open source systems out there. OpenMRS is a platform which has a community that is constantly upgrading it. It is worth...
You have the video? Can you show that video?
Yes.
Because we are short of time, let's go through the video.
But it's worth considering starting with an open source system and then looking at whether you want to actually invest in an EMR further. You might have to modify your whole examination room to facilitate better interaction with the patient with an EMR. The best part about an EMR is that how your workflow changes when you're interacting with the patient. For example, if you have a patient coming in who you haven't seen in the last 2 years and you can't remember anything, what has been done for the patient in the past, you can actually go to this is the EMR that we're using in our organization, and one display, you can quickly go through the entire history, all the images, all the investigations that have been done. This is in-house. This is Grayson Technologies. This is developed by us. In one screen, you can get every single investigation that was done. And this is a 40-second video where you have gone through everything done in the past. All investigations that, okay, I did cataract surgery in one eye, then he came for the other eye, this was the biometry, everything very, very quickly. An EMR can really, really improve your day-to-day working in the OPD. You can browse all kinds of data, glaucoma, refractive. And eventually, not only do you want to be paperless, but rather you want to be penless. Thank you.